You know, there's certain times in a person's life when your world gets turned upside down. And for Melody and I, it's when I had a cerebral hemorrhage.
We had a doctor that didn't communicate very well. I'm sure he was an excellent doctor, very knowledgeable, but trying to pull that knowledge from him was tedious and difficult.
There was no plan of care which said these are the things that should happen every day. This is what you can expect.
I was not given information on the possibility of a seizure. And a seizure is a very frightening experience, especially if you've never seen it before. Unfortunately, the seizure happened because he wasn't taking medication properly or diligently.
Patients with chronic care conditions like John's require constant medical supervision, but keeping them in the hospital is very costly, making it almost impossible to lead a normal life. One solution for John was an innovative, collaborative e-care management application. Using a mobile device, John uploads his current medical information so his caregivers can adjust his medication or even remind him to take his medicine, all without John having to step inside the doctor's office or a hospital.
SAP Collaborative E-Care Management allows individuals that have chronic or post-acute conditions to manage their health in the home by extending the concept of an in-community care plan. If you think about how care is delivered inside the hospital, what happens in there is that there are certain tasks and activities that the physicians and the nurses undergo on a day-to-day basis until the patient's discharged. Well, we've taken that same concept and applied it to the in-community setting. There are typically a list of things or activities that an individual with a chronic condition should undertake on a day-to-day, week-to-week or month-to-month basis. Be that take their blood pressure, monitor their blood sugar levels, take their medications, do exercise, etc.
Managing the growing number of patients with chronic conditions in the community rather than in a clinical setting will bring huge savings in healthcare in the future and mean people can go about their lives independently.
In the era and the age of managing people's health as opposed to looking after them just when they're sick, the overall health system stands to benefit from reducing the cost of treating a larger number of patients that have an increasing burden on the health system.
The care plan itself is unique for me. It's going to be different for a diabetic or someone that has congestive heart failure because it is individualized.
So using a mobile device like an iPad or an Android-based device, individuals can document, educate themselves, and interact with physicians in a way that allows them to be proactive about their health care.
I'm always wondering in the back of my mind, has he taken his pill this morning or has he taken it this evening?
You know, because I don't remember, right? You know, I have a very bad memory, and that's one of the effects of the seizure itself. So, you know, when I don't take it, Melody would be notified that I didn't take it, and she could call me up and say, you know, John, how come you haven't taken your medicine?
Hi, honey. I just got a text. It's telling me you didn't take your medicine. You didn't? Can you take it in the next 5 minutes, please? Thanks. Talk to you later. Bye.
The whole spectrum of patients can really benefit from living more independently and collaborating in a higher degree with their care providers. The idea is that it would lower the risk associated with being readmitted to the hospital or reduce the frequency of having to go back and visit the doctor for checkups. Because the physician and the care provider community has that information about them and can interact with them regardless of where they are.
For me, I see the solution as very much something that I need in a mobile way, to be able to actually have all my information right there where I need it.
It's great peace of mind knowing that he has something to look at that's telling him when I can't, saying it's time for you to take your medicine. That's reassuring to me.
The value and the benefit of being able to have a solution like that that allows the coordination of care across multiple providers, that allows for the proactive nature of collaboration with the care provider community, really will make a difference in how healthy people are and how people live their lives.